Lauren, last night photographer Connor Wilton and I experienced firsthand how the Jackson Narcotics Enforcement Team patrols the city streets to battle the growing heroin crisis.
If you find someone with crack, it's very rare. It's all heroin now. Marijuana's still there, but it's mostly heroin or prescription pills.
And that's exactly what Jackson County Sheriff's Deputy Andrew Sullivan uncovered in one of several traffic stops during our 3-hour ride-along.
So it did turn blue, which means it's positive for cocaine.
Deputy Sullivan says oftentimes people use a combination of drugs to feed their addiction.
He died right there on the spot.
Heroin and opioid abuse have left a path of destruction in Michigan, and tonight we brought together a panel of health experts, lawmakers, law enforcement, and court officials to talk about what can be done to stop it. And it is our top story tonight at 11. Thank you for joining us. I'm Sheri Jones. Now, throughout the entire month of May, we've been running a series of reports highlighting the opioid crisis in our community. And tonight, members of the public had the chance to weigh in during a special town hall meeting in Jackson. I moderated tonight's event, and our Veronica Gabriel was there as well.
What it became for me was far greater than I ever intended it to be. I never woke up and said, today I think I'm going to become a heroin addict.
It's called Rise, a recovery community located in downtown Lansing that, much like a phoenix, helps people gain a new life, rising from what many say is their lowest point ever. Well, they welcomed me into one of their recent meetings, and I was amazed by how Rise was working in dozens of young people's lives. At one point during the Club Rise meeting, I asked the group if any of them had lost someone to heroin. Nearly every hand in the room went up.
Such a great story, and it really sounds like the program's working.
It truly is. It's a family setting, and as you can see, when you see the epidemic that's going on with the opioid crisis, when you find out how many people have lost people they know to a heroin addiction, and programs like these are so necessary. And so,
right, and for them to have the courage to share their story, we thank all of them for that too.
Absolutely, for welcoming us into that very intimate setting. So we thank everyone at Rise. Inside a new building on the campus of Michigan State University, collaboration is happening between researchers from engineering, science, and medicine.
Michigan State University President Luanna K. Simon knew one visionary who could lead the way.
And that's Dr. Chris Kontag. He was wooed away from Stanford to come to MSU to share his vision for the brand new bioengineering building. And Dr. Kontag tells me it's exceeded his expectations.
So I see a place where people are really changing the way we think about the world, the way we think about disease, the way we think about and preserve health. And I see all the different disciplines in coming together in unique ways.
He talked with a physicist.
When MSU President Luanna K. Simon first met Dr. Kontag, she envisioned him designing something that was a magnet for several disciplines to collaborate on cutting-edge biomedical research. And now it's a 130,000 square foot reality with a price tag of $69 million.
He's a person who understands and appreciates this nexus of making things in biology and computational work, and is doing it in his own work now. He's an inventor. He's highly collaborative. He's a good listener to find ideas and not just be a shouter of his own, which you really need in a leader for this kind of work.
It was a journey halfway around the world that would take us to Homa Bay, Kenya. We worked in a remote African village with a Lowell community, building a home for an elderly widow who's raising her 4 orphaned grandchildren. Now, throughout the week, many of our team's conversations focused on the people we met and how our efforts helped to improve the lives of generations to come. For an entire week, the 12 of us worked hours in the hot Kenyan sun. We started by digging up the rich soil, using primitive tools, and then moving boulders one by one, creating the foundation of a habitat home for Consolata. When the last brick was laid and it was time to say goodbye, there was much to celebrate. Now, this is what Consolata's home looks like right now. I also wanted to mention that eaves troughs were installed on her house to capture the rainwater, which is then fed into a tank. So Consolata now has a fresh water supply for the first time in her entire life.